Hi, I'm Avery Neal, and this is Dr. Peter Berndt, and our next topic of discussion is anxiety. Now, anxiety is actually the most commonly experienced mental illness in our country, and it's usually something that people suffer with in silence. Unfortunately, there is still a stigma associated with anxiety and depression, for that matter, in terms of it being a sign of weakness, something that people need to just get over, they need to just relax or chill out, things of that nature. So for that reason, many people are afraid or embarrassed to speak up about it, but it is definitely our most common thing that we see in our offices, and people don't know what to do with it. So some of the most common symptoms, and of course, as with all illnesses, you can experience one or many of these symptoms, and this is not a complete list, this is just some of the most commonly experienced symptoms of anxiety. So feelings of panic, fear, or restlessness, feeling completely overwhelmed, insomnia, lack of appetite or overeating, compulsive behaviors or sort of ritualistic behaviors, such as, a common example of that would be frequent hand washing, cold or sweaty hands and feet, shortness of breath, palpitations, dry mouth, dizziness, inability to sort of sit still and relax, be calm, repeated thoughts or flashbacks. Nightmares can also occur with anxiety, nausea, muscle tension, and pretty much just any kind of sleeping problem is commonly associated with anxiety. So again, this is not a complete list, but they are some of the most commonly experienced symptoms. With that, I turn it over to you about the most effective anxiety treatments. You've been working with anxiety for many years now.
I have.
And have noticed some techniques that are quite effective.
I want to just say, first of all, that anxiety is something that probably everybody has felt at one time or another. And it usually has to do with a sense of something bad about to happen, some impending doom or some impending bad event or catastrophe, and then we react, and we picture that in our minds, and then we react in physical terms to that with increased blood pressure. Perhaps we have cold, sweaty hands, maybe tightness in the chest, or neck, or butterflies. Butterflies are a common accompaniment to that. So we have these symptoms in our mind, in the body. We have these physical feelings, and the mind reads these physical feelings, or the presence of these feelings, as something like, I must be anxious. And then often we get anxious about being anxious, so it compounds the whole problem. But mainly it is something that we read in our bodies that starts off with a physical feeling. And you can argue what comes first, whether the thought or the physical reaction to that. What people generally do, they try to, by willpower, override these feelings. And then that, of course, makes it much worse. Then we get into thinking, well, what if I, let's say I'm speaking in public, what if I lose the thread of what I'm saying, or I can't stop, I can't continue to speak, or whatever. So we picture all kinds of awful events following or accompanying the sense of anxiety. In this country, the treatment tends to be the prescription of what's called benzodiazepines. It's a group of medications that are the Valiums and the Ativan, Xanax, that group of medication, which can be helpful. The only problem is that it doesn't solve the problem. Once a patient goes off these medications, then the issue may recur. The other problem here is that some of these medications are habit-forming. So the in my view, the best approach to treating anxiety is to teach patients relaxation techniques. I found the teaching of self-hypnosis to be very effective in that, so that people then learn to manage their own symptomatology, and it restores their sense of confidence and their sense of being under their own control very much faster than relying on something from the pharmacy. That is not to say that the two couldn't be done together, because they can be. Prescribing something plus training in anxiety management. But eventually the goal of all of this is that the patient comes off the medication, is able to manage his or her anxiety effectively by themselves.
That is the ultimate goal, is that, you know, people are able to cope with their anxiety and overcome it and be able to manage it. Like Dr. Berndt said, it's not that anyone can ever eliminate anxiety completely, but at least when anxiety-producing situations occur, they have the tools necessary to cope with it and deal with it in the best way possible.
I think that was a good point, that the goal is not to eliminate it completely, because that's just not natural. Anxiety can have a useful function because it tells us that there's something amiss that we maybe need to fix in some way. But so the goal of treatment should not be the complete elimination of anxiety, but just an improved management of it.
Absolutely. All right, thank you.